House Bill 3057. Imagine this. You live in a rural Texas town. Your doctor tells you CAR-T therapy could save your life, but the nearest hospital that offers it is not in your insurance network. You call your insurer hoping the new law will help. Instead, they tell you nothing has changed for you. You still have to travel hours away or pay out of pocket. What the bill says it does? House Bill 3057 says it requires insurance companies to cover CAR-T therapy when a doctor says it is medically necessary and when the treatment is done at an FDA qualified facility. What it actually does? It only guarantees coverage if the facility is already in the insurer's network. This means insurers can still decide who gets access, while hospitals that are FDA certified but out of network lose the ability to treat you under your plan. Medicaid and CHIP patients are left out completely. Who benefits? Pharmaceutical companies that make CAR-T products, hospitals and oncology centers that are already in insured networks, and insurers who keep control over access through networks and medical necessity reviews. Who pays the price? Patients in rural areas who live too far from an in-network center, families with Medicaid or CHIP who are excluded from the mandate, and employers and employees who will see higher premiums as costs shift into private plans. Why it matters. Access to life-saving treatment comes down to network maps and contracts, not medical need. Families facing cancer do not have time for insurance games. When insurers keep control, rural Texans, working Texans, and low-income Texans face the steepest barriers. Questions you can ask your lawmakers. Why did the final version keep insured network control instead of guaranteeing access at any FDA qualified facility? What is the plan for Medicaid and CHIP families who are excluded from this protection? Should insurers be required to report approval and denial data so Texans can see whether the law is working? Bottom line, House Bill 3057 promises access, but keeps the gate in the hands of insurers and leaves too many Texans standing on the outside.